The big day is here. We got something that we've been looking for. It's the KIP Phantom, or also called the Khorman Injection Phantom. And as you can see, it comes in a pretty heavy-duty case. I don't advise you try lifting it by yourself because this thing is heavy. But let's see if we can stand it up. It's a large case. It's almost 5 feet tall, and it's been reinforced quite well. It has a proprietary hinge mechanism, and it's got the brackets on both sides. So this the KIP Phantom, or the Khorman Injection Phantom, comes pretty heavily and safely secured. We've already cut the straps that go around the box, and now if you have a look up closer, you can see that they put a nice little latch tie system on here. So that opens it up, and it kind of opens up very nicely. Inside, you can see it's very well protected with lots of foam that can be moved. And it also has foam on the side and everything else. So we put the box flat. We're going to have a look. You can see this is well covered by sponges, and I don't know, it's got a rather pretty face. I think I'm going to have to call it a she. All the foam nicely protects this. And this is actually a custom unit in the sense that originally the ribs 2 through 9 were not included. I had them replace the ribs 2 through 9 so that the difficulty of doing thoracic injections, especially thoracic discograms, the difficulty level increases. So I'm going to take out all of these sponges that you can see here, and we can see that it's covered with this latex skin material. The manufacturer suggests that this skin material may need to be replaced periodically, but if you notice, it's solid in the front. Of course, none of the injections are really being planned from the front, with the exception of, if you can see how the skin pushes down, it's very compliant over the left shoulder. So this is designed to do left shoulder injections, and also it's very compliant here, so it's designed to do fluoroscopic left hip injections. It's anatomically correct, period. So rather than anyone get hurt lifting this, what I want to do is I want to use a simple little strap mechanism. You can pick this up at Home Depot. If you notice, there's really no good place to grab on to the mannequin to lift up, and it's not light. I'm just estimating it's probably maybe 50 pounds. So what I've devised is this little strap that I can pass right underneath and pull up on the other side, and at least it allows me to have an easier lift. Now this is adjustable, this strap, but I think what I'm going to do is, for the time being, just kind of hold on to it here. I can twist it and I can lift up like this. I will get some assistance to help me stand her up, or at least squat up. She doesn't have legs. Now if you notice, you can see this sign. It's very tempting to grab under the neck, but here you can see the sign. It says, please lift Pixie, maybe that's the name they gave her, by her shoulders, not her head, okay? So in other words, don't lift up by the head or the neck. I assume that that's going to be fragile. So what I'm going to do is I'm going to have my colleague here come around the other side, and you just pull up while I lift up the shoulders. 1, 2, 3. Let's come towards me a little bit. There we go. And that just makes it for an easy lift. We'll drop this out of the way. And you can see she looks like she's about, I don't know, maybe a little less than 3 feet tall. There's some skin latex covering over the head, over the chest area. It looks like it's 3 pieces.